So I've been in nursing quite a long time. I started in 1995 as a student nurse back in Leeds and then moved to Newcastle once I qualified. Probably should have seen a PNA if they were around at the time because I didn't have any idea of where my career was going to go. I just knew that I wanted to come into work every day and just really enjoy work and hopefully make a difference to the people I was supporting. So initially started off in surgical nursing, worked there for about 6 years, but then my real passion was community nursing, so I moved into North Tyneside community, initially as a staff nurse, but then went on to be a district nurse. Loved the community. I just really felt as though I could deliver holistic care to patients. You didn't just look after the patient, you looked after the family, kids, pets, everyone that was in the home, and I think you really make a difference when you're in that environment. But one of the things that I loved doing as well was supporting others to develop. So I moved from the community into initially the preceptorship programme, supporting newly qualified registrants within NMAP within that first 6 months of their career progression. So supported them with pastoral care and supporting them to develop in the role. And then an opportunity came up to implement the care certificate within the trust. So that was similar support but for healthcare assistants at the time, and it was really about embedding sort of the trust values and supporting them with the core skills of what they would be undertaking in a supportive programme. And then the opportunity came up to be a PNA, which I did the course, and that led to the PNA lead role. And it's something I've just absolutely loved doing. I think as a PNA we can really make a difference to people, and although my role now isn't frontline patient facing, I think it's always having that sort of patient in the line of sight, so knowing what you do can impact on others is something that I really enjoy. So it was following the sort of COVID recovery plan. It was decided that they would implement the professional nurse advocate, and it uses the EQUIP model. So we deploy the model to support our nurses in a safe psychological space, and really giving the nurse that opportunity to be able to talk about what's going on for them, supporting their health and well-being, using all sort of aspects of the EQUIP model to support with restorative clinical supervision, clinical development, career development, personal development, and all of that really focuses on improving patient care. So it's for registered nurses who undergo an academic programme at level 7, which equips them with the knowledge, skills and behaviours to become a professional nurse advocate. And they do that by facilitating PNA sessions, which is a safe psychological space for the nurse to come and really talk about what matters to them, what they need to discuss, and help them to start to think about how they can develop both from a personal but also from an organisational resilience development, and how they can support patients with improved care but actually look after themselves and look after their own health and well-being. So PNAs can offer lots of different things. Using the EQUIP model, they can allow those nurses to come and just have that safe psychological space where they can speak up. And we've had lots of evaluations, both sort of nationally. The national evaluations are that it's really made a difference to staff retention and supporting staff's health and well-being. But we're also seeing that at a local level as well, because we do evaluations after the sessions. And some of our evaluations have really demonstrated the support that the PNAs have been able to offer, making the difference whether somebody comes into work the next day. A few people have actually said that they've not gone off sick following the session with the PNA, because it really empowered them to see what was important to them and how they could take things forward, what they needed to do. And sometimes just saying the words out loud is that pivotal moment where somebody thinks, actually, I can do something different here. So it absolutely supports the health and well-being of staff, because if you think if somebody's going off sick, from an organisational level, we do want to support them in staying in the workplace, but on a personal level, if somebody's off sick, the impact that has on home life, the personal life. So if we can make that difference and be there as that support for that person, then it definitely impacts on the health and well-being. I think because the PNA lead role is quite new, I feel quite privileged that we've got this role within the trust, because not a lot of trusts have a substantive full-time PNA lead role. But I think the trusts recognise the support that we do offer staff and have, recognised that and allowed the role to go ahead. So I think that's something that's a real privilege. I really enjoy that. I think the role is quite new, so it's ever evolving. I think the trust has given me lots of opportunities to be able to sort of evolve that role, sort of recognising what our staff needs are. So there is some national directives, but I think it's empowering to know that actually what we need to do is make sure that it's right for our staff as well. So we follow the national sort of directives, but then make sure that it reflects the needs of our staff as well. And I think just having a session with somebody and getting that feedback to know that they really feel like they've been listened to and actually they did know what they should do, they just needed that sort of space, that sort of listening ear for somebody just to talk them through about maybe what options were open to them. I think making that difference to somebody is probably the best part.